Hello, and thank you for joining this presentation. My name is Mike Strube, and I'm one of the founders of US-GeoMarket based in Dallas. And today I'd like to walk you through our Geo-Discover tool, which is our Qlik to Esri connector. But I want to do it with an emphasis on GeoHealth analytics. US-GeoMarket is a firm based in Dallas. We have been a Esri partner for over 10 years. We've been a Qlik partner, both in QlikView and in QlikSense for over 5 years. And our purpose is really to help your business be innovative through visual analytics. We believe that any company that's using geospatial analytics will create market advantages. And we know that's what we all need in today's big data-driven world. US-GeoMarket, as I mentioned, is a Qlik partner. We both resell the Qlik software, QlikSense, and QlikView. We perform consulting and managed services, and we do Sense conversions, taking your existing QlikView applications and converting those to QlikSense. We also have software as a solution applications and solutions for healthcare and education. But today, the emphasis will really be to look at the Geo-Discover platform of connecting QlikView in a healthcare application to Esri. The Geo-Discover tool came to me over the years as I spent time working at Qlik and also being a partner with Esri and seeing the need to bring mapping into the Qlik environments. So what we invented was this connector, and it allows seamless and bidirectional communication. What that means is if you interact with the dashboard, those interactions, those selections are interpreted by the Geo-Discover tool, and it talks to the Esri server. It brings back information and updates the map. You can interact with the map through our selection tools, through layer selections, geospatial processes, and we talk to Qlik and bring back the appropriate information to the dashboard. So the dashboard and the mapping environment are synchronized and coordinated. We do allow you to connect to either ArcGIS server on-premise, ArcGIS online, or the Esri portal. Now for the Qlik users watching the video, we all know one of the most important things we've learned with Qlik is green, white, and gray. For those of you who are probably Esri people, green, white, and gray means simply that when I make a selection in the dashboard, it turns green. And the whole dashboard and now the map are filtered on those positive selections. A white selection is something that is associated with my zip code that I chose, perhaps, and all of its fields are white. Every patient in that zip code, every facility in that zip code, they're white, and therefore they're represented in the dashboard in that way. And gray, the way I always learned it, gray means it's not in play. If I chose the zip code of Irving, Texas, then every other zip code becomes gray. Being able to view gray selections is important in Qlik, and we've allowed you to make that determination in the map. We do leverage all of the advantages of the Qlik extension objects. That's how this was created. And one of our latest additions, and I will show this to you, is TriView. TriView allows you to look at any point you select from 3 perspectives. 1, street map. 2, street view, so you can walk up and down the street, turn and look at the location. And 3, satellite imagery. Why do we use this? For example, if you're looking at a clinic and you want to determine, perhaps the clinic's revenue and patient throughput is low. Well, what if it's parking? Let's go in and look at the facility. Let's walk around the area. Let's look at the parking conditions, the street access. Maybe you're looking to open a new clinic or a new imaging center. Let's go to that potential address and look at the neighborhood. But always remember on the dashboard side, we could be bringing in the demographics from Esri to better analyze that potential location. All right, let's go to the demonstration. All right, what we have here, this is a QlikView dashboard, which is based on our Texas InPatient analytics. First question you may have, no, there is no HIPAA data in this. I can share this over the internet in a perfectly legal way. What we have here, we're going to demonstrate with 2013 data, which means that we have 2.2 million admissions in this dashboard. It also means that we have 2.2 million patients or admissions, but when we look at all their diagnosis codes, all of their surgical procedures, all of their charges, all of the hospitals, the clinics, we're aggregating up over 200 million rows of data. And that's what you'll see. You'll see me use interactively here. This is a standard dashboard. It's multi-tabbed. This is our top 10 list. This is where we look at the lines of business. We look at a number of admissions by gender, by pay group, the top 10 diagnoses, the top 10 hospitals, and so on. And those of you who know Klik know that I can just make a selection, choose a gender of male, and we immediately go to 870,000 admissions, and every piece of the dashboard, every object is updated automatically. And it turned green. Remember, green, white, and gray. I'm going to touch male again to clear that, and we're back to the full 2.2 million admissions. A hospital or a clinic would use a product like this in order to perhaps A, do market research, look at an area where they want to expand or an area where they currently have a facility. Since every hospital is in here, because this is state data, you can also use this to do competitive analysis. I want to study every Baylor Healthcare hospital, maybe because I work at Baylor or maybe because I work at Presbyterian. So this type of aggregated data allows me to study my competition. It allows me to compare benchmarks and look at my hospital and see how we do with cardiovascular patients, maybe mortality analytics or patient migration, which we'll go into deeper in a moment. But I can look at how does my competition do it. So there's many ways to use this information. But using this information, there's a variety of ways to look at it. From a dashboard perspective, I can look at Excel-style reports or tables of information, or I can look at it from a map. And that's where I think the data becomes more intuitive. So what I've done is I've clicked on the Patient Map tab, and that shows me every zip code and proportionally how many patients they have, how many admissions they have in a zip code. Now, you only see the 3,000 dots because there are about 3,000 zip codes in the state of Texas. We do not have every patient in the database because that would take us into some HIPAA privacy issues. These are aggregated at the zip code level. So we're getting our first look at the Geo-Discover mapping environment inside of a QlikView dashboard. So let's walk through some of the functionality. So I mentioned earlier green, white, and gray. So I have green checked and I have white checked, and I do not have gray checked. Just that easily, I could change that and look at every patient and every aspect of their visit, whether I make a selection on them or not. All right, we also have home, a home button. This allows you to recenter the map and very quickly come back to the center of your study area. Normal navigation, zoom in, zoom out. But let's get to the good stuff. We allow you to switch base maps. Perhaps you're comfortable in a street map view like this, but as you begin to zoom in on a certain hospital or a certain city, you want to look at satellite imagery. Well, you just simply select that base map, and you're in satellite imagery. We'll zoom in. We're going to the Amarillo area. And if we go to a single hospital, we can go in and look at their facility, their campus, just that easily. Let's go back to a street map. That was Lubbock. You can have as many layers as you wish. in your map, in your dashboard. These layers come from Esri. So either your Esri department has created these or you have created them inside of ArcGIS Online. So you can turn on and turn off layers by just clicking them. So what we have here is we have a layer we've labeled flu outbreak area. So just that simply, we turned it on and we can see that Abilene, San Angelo, the Big Spring area, those are all under the perhaps state-defined flu outbreak area. But we want to understand what patients are underneath here. So this is a geospatial selection. So we can go to our selection tools. We have a variety of them. We can do a rectangular selection. I'll do that. I'll do a rectangular selection around the Lubbock area. And what you just saw happen was it zoomed in. It has talked to Esri and said, what have I highlighted? What zip codes have I highlighted? And it got the answer back from Esri. We then handed that information to QlikView, and it said, go in and filter all of the zip codes in the state of Texas based on our geospatial selection. And so every dashboard, every tab in this dashboard updated, and we went to 34,800 admissions. So now I could go look at the patient profile, and I can see that of these 34,000, we have 10,700 are Hispanic, 23,900 are non-Hispanic. I'm hovering over this area, 6,500 are Medicaid, so on and so forth, by just making a rectangular selection in the map. Let's go back to our map. All right, so we've got this area highlighted. Now, it's QlikView. All we have to do to return to where we were is hit the back button or simply clear that selection of zip codes. So just that easily, we're back where we were. Now let's turn on the flu outbreak area. Let's zoom into this area so we can see it a little clearer. And let's make another selection. This one is a more pure geospatial. We want to select the layer to make a selection on flu outbreak area. And we had a new icon up here. This is a point icon. So I'm going to work with that. So I click it. And now I go pick the layer I wish to use to make a selection. I click that. It gives me another question. It says, underneath this flu outbreak area, what do you want to pick? I want to pick admissions. That's all the people underneath. And I select that. So it's talking to Esri, and it's bringing back that information. So we've now done a geospatial selection based on a flu outbreak area, and we have filtered the whole dashboard to show us that 54,912 admissions were made from zip codes underneath that flu outbreak area. They may or may not have had the flu. We can do further selections in QlikView based on diagnosis codes to work with the flu folks. But this gives us an immediate representation of what patients in this calendar year lived underneath that flu outbreak area. They may have gone to the hospital in Abilene, right in the middle of the area, or they may have gone to Amarillo, or Houston, or Dallas. We can study that via patient migration. So we can look at patients who came from this geographical area but were admitted to hospitals in the Dallas area. How can we do that? It's very simple. Right now, we have filtered 55,000 patients who live in this outbreak area. But if I come to my hospital selection area and I say, only show me patients who were admitted to a hospital in a certain county, and I'll just type DA Dallas. So from 54,000, I now have updated to 1,082 patients came from this geographical area and were admitted to hospitals in Dallas. Well, which hospitals? Let's get a little more detail on our hospital profile tab. So by going here, we not only see a map of all the hospitals in the Dallas area, but down at the bottom, we can look at the number of patients for each hospital who came from that area. So Baylor University Medical Center had 280 of the over 1,000 admissions. Parkland had 42, so on and so forth. So we can use this to study the rest of the dashboard and look at everything from mortality analytics on those 1,000 patients coming from West Texas. We can look at diagnosis codes. We can look at hospital-acquired conditions. So by doing one geospatial selection over a flu outbreak area, we're able to go deeper and deeper and deeper into the metrics of those patients. All right, so we've got this zoomed in on some hospitals here in the Dallas area, but zoom in just a little bit closer. And let's pick one hospital. I'm going to zero in on this dot right here, and I'm going to click that, and I get a pop-up of information. Remember, we're in our Geo-Discover mapping area. So by touching that hospital dot, I get a pop-up which tells me this is Baylor Heart and Vascular Hospital. They have 64 beds on average, 18 are filled, which is a 28% filled rate. But there's several things I can do in this pop-up. The first thing I want to do is show you TriView. This icon here shows me TriView. And when I click that, it's going to open another tab in my browser. And it's going to show me the street map. Where am I at this hospital? And it's going to show me the street view of this. And I can use the tools here to walk around. You see that my different views are synchronized. So I can walk around, look at this location, look at this campus, and you see it turning here on the right side. I can use the tools here to rotate the map. So I can study this campus from a lot of different sides. This is TriView. All right, let's return to our tab for our dashboard. And the other thing we can do on this point, and we may be an administrator at Baylor Heart and Vascular. So I want to look at a study area. I want to maybe look at a 15-mile study area and understand the patient underneath here. Maybe I want to do a drive time analysis. So I can do a 15-minute drive time around this facility or this location. So you're starting to see some of the power we've incorporated into the Geo-Discover tool. Now we can run reports. If I want to run a report on this location, this is looking at the ArcGIS online module from Esri. Included in that ArcGIS module are pre-built reports on medical services, on spending behaviors, on demographics, on insurance spending. So I can look at propensity of people or zip codes underneath this 15-mile study area and look if it's above average or below average for income or for spending on healthcare insurance. All of those data points are available in Esri. Now you see it's asking for a username and password. If I'm an individual user, I may have an account and I can get this report, or your organization may have a username and password, and that can be hard-coded to a proxy so that all of your users can automatically get these reports and not go through this sign-in. I want to clear that. I'm going to turn off this pop-up. All right, let's clear our selection, that flu outbreak area we had, and let's just go to a hospital service area tab. So what this allows us to do, the default for this map was satellite imagery. I'm going to change that to a street map. And I'm going to pick one hospital. I'll just pick, let's clear the hospital only in Dallas County, and let's go back to the whole state. Talking to Esri, bringing back fresh information. And we are bringing in about 3,000 zip codes that have patients with data. Now you see there's some holes in here. Texas is a big state, and there are zip codes which didn't have one patient admitted to a hospital in 2013. That's not unusual. Let's pick Abilene Regional Medical Center. I chose it because it's on the top of the list. All right, so here's what we've got. We now have 7,498 admissions, and it's broken down by zip code. Where did those admissions come from? And now it's color-coded. So I can see that around the Abilene area is where they got most of their admissions. That's logical. But they had some admissions from in the Big Bend area, or out near Lubbock, Odessa, Midland. Maybe those people were just passing through town and had an automobile accident and were admitted to the hospital. We could study them more deeply, but that's not the intent of this demonstration. So right now we're looking at the concentration of patients, the primary service area map for this hospital. But let's think about it a second. Maybe I'd rather study cardiovascular. Well, we have predefined selections to allow you to study angina, arthritis, asthma, bone joint trauma, breast cancer, burns, cardiovascular, or you could use a very detailed MSDRG to study one specific diagnosis code or a surgical procedure. So let's look at this from a cardiovascular point of view. I'm going to select cardiovascular. We now have a different concentration map, another primary service area map for this one hospital for cardiovascular disease. But let's take it a step further. Let's go into an age range, and let's only look at patients 40 to 44 who have cardiovascular disease and were admitted to this hospital. I now have a different primary service area map. I could go in and study pay groups. I could study insured versus uninsured. I could study payer codes. I could look at Blue Cross, Blue Shield versus other insurances. I could look at ethnicities. I could look at surgical procedures. And only by just clicking the dashboard, I can automatically see a synchronized primary service area map. That's pretty amazing. Let's go to another tab and explore this Texas InPatient Analytics for a moment. Now, we're only looking at one hospital, so let's look at hospital mortality. We only have one hospital, so we only get one data point. Let's clear that hospital. So now we're looking at patients 40 to 44 years of age with cardiovascular disease, and we're seeing that in 461 hospitals admitted patients with that profile, and they had a 1.3% mortality rate. We can study that geographically for the Dallas area. We can look at hospitals in my county, or we can look at only patients that came from Randall County and were admitted in the Dallas-Fort Worth hospital. So you're beginning to see that this is market research on steroids. We can study our hospital, our doctors. We can study our competition. We can study patient migration as it moves across the state. So by using the QlikView dashboard and hundreds of millions of rows of data, we can study these patients. But when you add the entry mapping, suddenly you're adding a whole nother intuitive level to it. And when you add TriView, and when you add pop-ups and defined study areas. So with all of these tools in place, this allows you to make very, very detailed decisions based on very, very detailed information. All right, if you'd like to talk about this further, visit our website, www.US-GeoMarket.com. Visit our blogs, join us for webinars, give us a call. We would love to visit with you about Esri mapping in QlikView or QlikSense. In particular with this demonstration, Texas InPatient Analytics or Outpatient Analytics. This is applicable to any state. I simply demonstrated Texas. Thank you so much for your time, and I hope to talk to you soon.